But just as we must be clear that the disharmony is secondary compared to the qi of the person, we do have to be clear about the mechanics of this disharmony. So for the next brief little time together, we're going to imagine every body is identical. Same strength, same age, a machine without feelings or other influences that need repairing. Basically the Model T of bodies. Same one, all the time. So we have these machine bodies that are coming in so that we can talk about the disharmony itself. So today, that is to say the layer we're going to look at today, and this is not how it really is, it's a layer upon a layer of looking at it, which will hopefully make things clearer for you, is the relationship between the Zangfu. But please, do not think what I'm talking about is Zangfu theory, nor do not go, oh, 5 elements, and stop listening, or miss what I'm saying. Because what I'm about to do is not Zangfu theory, and it's not 5-element theory. It's talking about the things that Zangfu theory talks about and 5-element theory talks about. Does that make sense? Those are all just ways of talking about something over here. And I'm going to be talking about the same thing. So don't latch on to familiarity here. So, what I'm talking about is understanding qi. The effects of qi when they cause a disharmony in the organs, and then the relationships these organs have with, for our examples today, the shun, insomnia, the heart, digestion, spleen, stomach, IBS we talked about, and I'd like to work in the skin. So if we were treating eczema, dermatitis, all of those things, looking at it from the perspective of qi and the organs of the body. We have the heart. That's not going to work. We have the liver. We have the spleen. We have the lung. We have the kidneys. All of us have seen this so many times. Insomnia. No matter what we diagnose or say or think or use Sanjiao or Zangfu or whatever you want, there is an issue of the heart. If we're saying insomnia, we are saying heart. Doesn't mean we have to treat the heart. Doesn't mean that everything revolves around the heart. But by definition, the shun is housed in the heart and the blood. And if they're not sleeping, if there is a problem, then this is the problem of what's being affected. Flat out. There's just no other way to talk about it. We can come up with other things, but it all comes back to the shun. And if the shun is not in the heart and its palace, and it's not spreading through the body, in the blood, it will not sleep well. So why? What's going on to the shun? What's happening here that it's being affected? Well, is the fact that the liver qi, please don't start thinking 5 elements or Zangfu theory, even though it's going to sound like I'm saying that. Liver qi does what? Liver qi is in charge of moving the qi through the body, all the way around. It's in charge of the qi. It's moving the qi, but it's prone to up. It's prone to not just up, but too much vehemence outwards. It's not just up is not this way. Up is a 3-dimensional direction from anywhere. From the middle of your bone, up is any direction out towards the surface. So the liver qi pushes things away from the middle of your body. It's moving things around, and on top of that, it makes it up. All right? So, do we have a problem? Is our patient's qi too up, too agitated? And therefore, because of this, the heart cannot go into rest. The shun cannot calm because the qi is too raised. The qi is too excited. The qi is too active. The problem is raised qi, excited qi. And I could say, 8 functions of qi, treat insomnia because of this. There's something going on here. But what happens if there's a lot of worry, if the person has anxiety, has concern, what happens here is the liver comes around and the heart chi, instead of being calm, gets rank, 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 and gets irritated. It's like bink, 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 hey, 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 hey. Over here, the heart chi is supposed to keep moving, and it hits something that doesn't allow it to move because it's congealed. The chi has knotted. The chi is being held. The chi is too gathered. The chi is too closed in. It's not raising. It's not lowering. It's not exiting. It's not entering. It is being congealed and held. And so therefore this hits this and builds. Hits this, bounces back. Hits this, bounces back. And pretty soon we have excess here. Not because this is irritating it, but because it's not able to get through. It's being trapped in half of your body. The middle jiao is not allowing communication between top and bottom. Given a small enough space, start building up, and we have this. But this isn't heat. It's not like they can't sleep. They go to sleep, but then as it starts to rest and starts to chi moves, it hits this and comes back, and it's like, whoa, what are you doing back here? Right? There you are, you fall asleep, your friend leaves, and you go to sleep, and then they come back in. You're like, that was obnoxious. They came back, they opened the door. It's like when you have house guests and they insist on going out at night, right? You have like a baby at home and they're staying at your house, but they insist on going out. Yes, that happened to me, which is why I'm talking like this. And then just when you've managed to fall asleep, they come back at 2 in the morning and you gave them keys and they don't know how to use the keys because there's 3 and they're like, and half of it they got the wrong key. The other half is they're missing the hole because they've been out, right? Because, I mean, if you come all the way to China and see us, what, you're not going to go out and look around what's going on? I get it, but I mean, never mind. So, boom, bang, comes back. Middle of the night, you wake up again. You fell asleep, but you can't stay asleep. Something keeps coming, something keeps coming, something keeps coming. All right? So, here we have this problem. Patient number 1. It's here. But don't say it's a liver pathology patient, right? The shun is being disturbed. Why is the shun being disturbed? Because it is being excited, agitated, and not given a chance to chill, to calm. Here, it's not having a problem. It can be calm. It's welcome to be calm. It's really tired. It's exhausted. But every time it goes into a place where it gets calm, something comes back and bounces back at it. It just can't spread through. If I keep going, you're not going to be able to see anything there, huh? Oh. Insomnia, shun, heart, being affected. Patient number 3, take your pick. Depends the symptoms going on, but the biggest issue is yin-yang has separated, right? And so the yin-yang that's supposed to be here is separating out, and so the yang is floating up, and they can't get deep enough sleep. They just can't do it. Or the lungs are not descending, and so because they're not descending, chi is being stuck up here. It's a gentle stuck. This person doesn't have the wide awake insomnia like this. This person doesn't have the sound asleep and then wakes up and is whatever's going on. This person they might as well have spent the night in a chair dozing because they don't get that deep sleep. Or if they do, it's very short. But the issue is not an excess nor a banging. There's just separation of yin and yang. And so our object is to strengthen yang as well as yin, because only if they're both strong are they going to be able to stick together, right? I mean, basically, as we age, the glue between our yin and yang loosens. And then instead of going whoop dramatically, it just kind of goes, yeah. And so we have to revitalize and encourage. We have to do the bellows of the fire gently, because if someone is elderly and has this and these are weak, and we go in with strong bellows, we'd snap it. The organs can't take a fast rush of chi. This elderly person can't take like get it right up the channel, then I'll do a big drain and I'll match the two. Things are fragile. And so it has to be gentle. And our strategy has almost nothing to do with, might seem, insomnia. It's about nourishing kidney, lung, so that this is able to hold on to qi, and this is able to drop qi. All right? Lung is not dropping the qi, kidney is not grabbing the qi. And so by strengthening both their yin and their yang, just enlivening the person, these two start communicating, and next thing you know, they have some sleep. And so if we can start seeing all of these things, the things that are in our books, that are the theories we've all memorized, it's 5-element, it's Zhangfu, it's this, it's that, and stop seeing it as these names and just seeing, what does that mean about qi? Person is eating very high calorie food and develops digestive heat and starts getting irritated, and they're really angry about something, and the weather is hot. So we have a lot of influences that's forcing the qi to be agitated and up. We give it a label, liver qi yang rising, but the liver qi didn't go anywhere. It's that the liver is unable to make the qi move around the body. There's no such thing as liver qi. The liver is in charge of moving the qi you have. That same qi gets to here at night and is supposed to go calm. That same qi is supposed to spread everywhere. That same qi is supposed to get cooled here and descend down. It's not there's such thing as liver qi. It's how the liver is influencing the qi in your body. And then the qi gets agitated for other reasons, nothing to do with your liver, and therefore is stuck up. The liver can't do its job. It's unable to do that, and therefore we describe it as a liver pathology. But there's no such thing as the liver pathology. There's the liver is not doing its job, or something happened to the liver, so it's unwilling to do its job. Yin-yang. Do we see that? All right? Same thing all the way around. And so how can we hold this as the tenet of our understanding and at the same time not fall into a trap of believing this is what's actually happening? I mean, do you really think there's a spleen qi? Wait. No. As we digest, our qi needs to undergo a process. And we use the word spleen to describe that. We say that the spleen does that, but there's no such thing as spleen qi. There's just our qi going up and going down and gathering and dispersing and spreading. We got to really erase that word. I've really realized that by using dispersing in English, there's such a negative connotation there. Dispersement. Spreaderst. Spreaderst. Right? If I can coin that, right? So, we are always in our treatments focused on the qi. And then we need a language to explain what's going on. And this was a common language used. But then people have fallen into a trap of believing these things are what they are. Okay? So, we have insomnia. You go right around it. You come any way you want to attach the insomnia. I mean, forget insomnia. Somnolence. Right? Well then, the shun is not being activated enough. What's going on? Is there not enough qi for the liver to push? Is the liver weak, unable to push? Is the spleen not providing nourishment so that this gets fed? Are the lungs breathing so poorly? COPD, any of those things that it's not spreading the qi through the body, and therefore the body's not getting enough, and so the body has to run on a very quiet, and the person can't stay awake. Because only when they get to a state of almost asleep or asleep when the heart rate goes slow, does their body have enough. For every moment that COPD patient, that patient with damage to the lungs, whatever it may be, is awake, and the body's like, oh, we need more stuff, it's not getting it. Because the lungs are not disseminating through, what the shun is not able to travel through the body, right? So however you want to look at it, this is what's going on here. So let's look at IBS. All right? So if we look at IBS, we do the exact same thing. We have to say, no matter what we say, that if there is a problem of IBS, we are dealing with the spleen. And please, in Chinese, everything is mostly, but never 100%. So this is the five zang and all of these things. But I mean, the spleen stomach is one organ in Chinese with an up-down yin personality. And so, you hear the rest, you read the books, and nobody ever says, like, the heart, small intestine. Right? I mean, you don't barely hear that at all. But you're constantly seeing the interchange of the words stomach and spleen for the same concept. So, whatever's going on with IBS, there is a problem here. Things are not gathering correctly. Because really, what is digestion but then gathering and then dispersing? And so either it is gathered and not dispersing, or it's dispersing and not gathering, or it's gathering, dispersing really quickly so that you end up going 5, 6, 10 times a day. But there's a dysfunction of gathering, dispersing. And then we're going to say, oh, well, it's liver overacting on the stomach, liver overacting on the spleen, as if something's happening here. But what does that mean? It means that the qi is unable to gather because it's being zapped and bothered and irritated by too much up in the qi, which doesn't mean the liver's doing it. It means the liver's unable to affect the qi to go through the whole body. Right? The qi is just the qi. But we have to have a language to be able to understand. And so when I say, the liver is overacting on the stomach or spleen, then my treatment is going to I will treat liver points, and I need to disperse the liver qi. Well, that's all a fancy way of saying I need to lessen the intensity of the qi in the body, irrespective of the liver. It's just, this was a way of helping us get it. But then we say, well, but these points, well then I'm working on the gallbladder channel because it's more easy. Well, the gallbladder and the liver have an inside-outside relation. I mean, you can map anything to anything you want, but hopefully we're starting to see that basically while there's places that are easier and less easy, we can do whatever we want to the qi anywhere in the body. There's just easier places and harder places. So we can lower qi or raise qi or weaken qi or bolster qi at any point. But some points are just way too hard to make the commitment to. And other points are really easy that we default to. But there's nothing special about the liver channel that makes it unique to do something. It's just easier on a lot of those places. So, we know we have a problem in the spleen, a gathering, dispersing problem. And is the qi going too fast or hitting it or not letting it calm or not letting it descend because the qi's raising, so we use this word? Or is the qi not dropping? It's not that it's being lifted, it's just not dropping. There's no drop, so there's no bowel movement. And then every once in a while, it just drops too much, and they get the cramping, and they have to go. IBS, constipation followed by diarrhea. Well, then that's this. But it's not the lungs. The lungs are in charge of descending qi. And then we get the analogy in the books of the teapot. The Chinese teapot has a hole at the top. So if you're pouring a tea with a Chinese teapot, all you have to do is put your thumb on the hole at the top, and it stops pouring. So when you're doing the tea ceremony, that's the point of that hole, is that you've got it, and then you're pouring in this cup, and then you tap it, and you move it, and nothing leaks out, right? And so if the lung qi is not communicating with the intestines, then the hole is blocked, the water can't leak out, or you can't have a bowel movement. So I'm certain that the books in English also talk about the teapot analogy of the lungs are blocked, and therefore they have constipation below. But the lungs didn't block. The lungs have a bellows motion. And they are moving, and they move our qi. And if it's moving in a good way, the qi will have the strength to reach the lower part of the body. And it will be given weight to it. Something's going to happen in the lungs that our qi goes down easily. And so if the qi is not going down, then we're going to work at the lungs. But it doesn't mean that there's a problem in the lungs. The lungs show problems if the qi isn't going down. But it's the qi. The qi's in the middle. It's qi that we're talking about at all times. Kidneys is the problem that it's cold. The Mingmen fire is not strong enough. So the food comes in the system and it hits the stomach and it passes on and it hits the spleen's supposed to do its job, and then right when it's supposed to hit the furnaces that are going to help lift the qi up into the body and be dispersed everywhere, there's no fire down there. And so it passes in, and then instead of being warmed and spread out, it hits cold, it congeals, and then you get intestinal cramping, and you have a bowel movement that needs to come out right away. IBS, cold pattern. Stoke the fires of the Mingmen. Well, honestly, there's no Mingmen, even though I treat the Mingmen almost every day. I have to stop the qi from being too weak and have no warmth to it. I need to rewarm the qi. I need to spread warmth, gather fire. I mean, it's like this double idea of I need to gather yang so it can spread things out. And so I do that. I warm the lower jiao. I make cold disperse. I make things move, and IBS goes away. But I can't throw points in the kidney channel and think that's going to somehow magically fix the spleen. I mean, maybe I can't. I said that correctly. Maybe some people can, reliably. You just keep moving around, and we can start seeing that each of these has something that they govern, but there isn't something of itself. Each of these represents a term they use to describe a dysfunction of qi that gave them a handle to work with, a relationship to plan for, that aided in the very basic idea of there's one qi and there's a disharmony that we need to reharmony. It's just a toy, a tool. So, eczema, psoriasis, dermatitis, that's hard to treat. That's just no fun at all. But what do we know right away? We know right away the problem is in the lungs. No matter what we may think, no matter what we all see, no matter what other patterns they have, we know the lungs are in charge of the skin. Now, of course, are the lungs really in charge of the skin? Like there's some pathway? No. But something is going on that is represented here by the qi. And so, anytime we're treating a skin disorder, we have to think about the lungs. But we don't think about the lungs, we think about what's going on with the qi. Is the qi too hot? Is the lungs too dry? Is it too damp somewhere else because things are not moving? But whatever happens in our patterns of flow, we know that we need to think, okay, insomnia, I can't lose sight of the shun in the heart. Whatever language I use to describe, whatever I'm going to do, it has to consider the fact that at the core, in this medicine, the theory I have states that I've got a heart problem. Something is making the heart have a problem. It's not necessarily the problem itself as a thing. The heart is being irritated by. That's what I want to say. The heart is being irritated by. And then we have to answer that question by too much up, too much gathered, too much dispersed, too much whatever it is. And then we look around and explain that. In IBS, any digestive problem, we know that the spleen-stomach relationship of transforming physical things in our body. Food comes in and drops through the stomach, hits the spleen, and then it gets spread. So at this moment, we know that something is irritating that. In skin problems, we know something is irritating what we call the lungs in Chinese medicine. And then we need to backtrack out. And if we do, we will end up much more effective because we are treating a disharmony of qi, opening, closing, gathering, dispersing, raising, lowering, exiting, entering. But on top of that, we have a direction, upper jiao, relationship to the skin, and then what's going on? What of these functions of qi are affecting it? Is the qi too agitated? Is the body not calming down? So there's no yin. And if the yin is not able to nourish and soften the skin, then any heat that's up there ends up flaring into dry psoriasis or hot eczema or burny, cracky dermatitis. And so we could say, we need to nourish the yin. We need to calm that. Oh, we're going to calm the liver. If we calm the liver, then the skin will get better. All we are actually saying is that we are going to lower the intensity of the yang on the skin, and or we're going to bring up the yin. And as the yin grows, it's heavy, and yin and yang are together. It's one qi. There's no such thing as yang qi and yin qi. It's just that the yang aspect of that qi, the lifting aspect of the one qi, is going up. And there's not enough lowering aspect of that qi, the same qi. And so I say I'm building yin. I'm not. I'm working the same qi. I'm just making that qi heavier, wetter, cooler, calmer. And that's working with yin. And I'm irritating that qi. I'm making it move. I'm making it warm. I'm doing all those things. I'm treating yang of the qi. But it's not yin and yang separated. Right? And so if I make the yin heavier, and I weaken the yang's excess at the same time in my treatment, then together the yin's weight will pull down the yang that's been weakened, and irritation on the skin goes away. Is the problem the other way around? That the yang is not moving the yin off the surface. So it's weeping, it's damp, it's whatever it is. And so therefore, I have to figure out how to bring it in or make yang get up there and wash the area, flush the area. I mean, if you've ever wondered how, if you do herbs, how huang qi, this warm, tonifying, acrid herb, is used for skin lesions. What? Heals sores. And you're thinking, let me get this straight. I'm supposed to put on a warm, acrid herb on a red sore, and it's going to magically treat it? Wow, huang qi's cool. The answer is so simple when we see it. It's only going to do that if the reason why there's a sore there is the yang qi is not getting there to take the garbage out, and therefore the garbage is rotting. And as it rots, it ferments, and you end up with a hole, a bed sore. A bed sore is due to bad circulation. So therefore, my treatment of bed sore is increase flow and circulation, build yang, make movement, agitate, and this red festering sore gets better. That's the mechanism. That's where huang qi works. You give huang qi to somebody else who doesn't have that mechanism, they're going to get much worse. You give a stimulating treatment to someone who's already got a lot of qi, you're going to make it worse. You create good yang flow to the feet in a diabetic with non-healing sores, they get better. Well, what do you say? Well, I'm treating the spleen, or I'm treating this. We're affecting the qi. And this is just language. And so, what do I need to do? I need to soften the lungs so that the qi is able to drop through the body and reach the extremities. So it's not stuck in the upper part of the body. And is the lungs stuck up here? So the skin is having a problem because things are gathered and stuck here. And there's nothing actually there, just it's stuck in the middle. Or it's stuck in the top, unable to go down. Or it's not strong enough to be pulled down because it's weak here. That's it. So, when we look at insomnia, there is a protocol for insomnia. It's being clear on what qi is going on. What aspect of this is going, And then we have language through this relationship that allows us to easily strategize a treatment. That's Chinese medicine. But the moment we start treating this, or this, or this, or this, or this, or thinking that Zhu Sanli stomach 36 does something if we just stick a needle in, or we prescribe herbs because their action says something, we're going to end up making more mistakes than non-mistakes. And luckily, most of the time, it just means no progress, nothing happens. But (1992), 22 years now of being in practice. And 1993 was when we started crisscrossing the states and doing tours with these people. And so therefore, teaching them medicine, we'd be in schools, we'd be in people's clinics, we would be doing guest treatments, we'd be going around, first Professor Wang, then Dr. Xie, all the people I've been working with all these years. And so I've actually had a huge exposure to the population of practitioners. Even though it's brief, but I meet them, I see them, we treat their patients. And I can tell you how many times the problems their patients had were from the practitioner and not the problem itself. Because they got tangled up and didn't just see this, that it's one chi. Please.